economic modeling is very wide and a huge topic, but due to the time limits, I will go through it in the main things, okay? So first, in general, I will talk about the type of economic evaluation based on data source, the type of economic modeling, process of conducting a decision analysis, step to conduct an economic modeling, and finally, the advantages and limitations of each type of modeling. So at the beginning, Dr. Samah, she talked about in her previous lectures about the type of economic evaluation. She categorized them based on the type of outcome measure to cost effectiveness, cost utility, cost benefit. But we have another categories based on the data source. So we have the 3 types of economic evaluation, which are economic evaluation based on alongside observational study, economic evaluation alongside RCTs, and economic evaluation based on economic modeling. So economic evaluation alongside RCT and observational study, they mainly measure and they estimate the cost and outcome from one data source, either RCT or observational study. They collect it alongside the clinical study, okay? So the advantages of the economic evaluation alongside observational study, that they are generalizable, as you know, to clinical practice, so they enhance the external validity. However, they are prone to selection bias. Whether the opposite with the RCTs. RCT, they have high internal validity, and whereas they have low external validity. And the most important things about these types of economic evaluation that they are used for short time horizon. It's very time expensive and consuming to estimate to collect cost and outcome for long term. So we are mainly use economic evaluation based in economic modeling. The advantages of economic modeling that it allows combining data from different sources, which are the transition probability, utility, cost, and also they can extrapolate beyond the time horizon. Economic modeling is a mathematical one, is a mathematical structure that simplifies reality to a level that describes the essential consequences. Okay, so briefly I will talk about the process of conducting a decision analysis based on modeling. We first start with identifying the research question, followed by defining the most appropriate models, and then we have to collect the clinical evidence and economic data. Then we will do the ISA, the incremental economic analysis, and also we then have to deal with the uncertainty and present the results in SIAC and cost effectiveness plan. Okay, I will not talk about the process of this kind because I don't have a lot of time. So I will focus about the models itself. Regarding the models, we have 2 types of model, cohort model and patient level simulation model. Cohort models, which are the commonly used in literature, they are 2 types, MARKOV and decision tree. So they simulate the expected cost and outcome for a hypothetical group of patients. They have similar characteristics in terms of age, sex, gender, and comorbidity, for example. They simulate them through the model at the same time, okay? However, the patient level simulation model, they simulate each patient separately or individually. They simulate the expected cost and outcome. The most common, we use the DES. So, sorry, I don't know how I go back. So today I will focus about the Markov model and the decision tree. I will start with the decision tree. So the decision tree is the simplest type of economic modeling. They are used to reflect the treatment pathway for diseases with short time horizon. So it's the simplest type of economic modeling. So if you want to have a look about how the decision tree is, it looks like this. I'm not sure if it's clear, the image. So here, like there's an example for a patient with depression. So we start with the population. We have the square. I don't know if, yes. This is the decision node, okay, where we have the treatments. we have the chance node, the probability of the event to occur, okay? We have here, we're comparing SSRI and TCA, okay? So we have the probability of either to be effective or not effective. We can have more than one chance node, okay? And then we will end up with the final outcome will be the cost and utility, which is reflected by the triangle one. So I'll talk about this. So the limitation of decision tree, they are unsuitable to model chronic disease with recurrent event like breast cancer, diabetes, hypertension. Okay, why? Because like we noticed that they are like the tree. They stemmed with the branches. So if we want to model recurrent event, it will become very pushy to analyze, okay? And also it allows one-way progression of the patient through the model. And we know, like in chronic disease, sometimes some patient, they can go back 2 minutes?
Yeah.
But it's 20 minutes.
We have also in this, before the lunch, we have extra two sessions.
Oh, so it's, okay. 5 minutes, okay.
Yeah.
So quickly, I'll talk about the Markov model. So Markov model, the most commonly used for chronic disease, simulate the natural history of a chronic disease where multiple events could occur during the clinical course of the disease, okay? So if we want to construct a Markov model, we have first to define the structure of the model. We have to identify the starting probability, define the transition probability, cycle length, time horizon, and the stopping rule. Then at the end, we assign the life year gain cost utility for each health state. Then we have to do discounting, incremental analysis, and sensitivity analysis. Okay, so I don't know if I have 3 minutes now. 3 minutes? So I can't talk because we need a lot of time for Markov. So in a brief, okay. I want to show you the Markov model itself. A simple one, sorry. No, I think, okay. Just I will talk about the limitation of the Markov model and one of the studies we conducted recently. So the limitation of Markov model, although it's simulated for chronic disease, it has the memoryless feature of Markov model. They don't account for any history where the patient came from, okay? Also, they assume uniform population and equal constant risk. So finally, due to the time limit, I just want to shed off the light of one of the recently study we conducted, me and Dr. Iman Hamad from University of Jordan. It is the first economic-based modeling. Sorry, I can't control of it. Cost effectiveness of pharmacist-led care versus usual care in type 2 diabetes, diabetic Jordanian, okay? So this is the first economic modeling based on Jordanian data, and we aim to highlight that the clinical pharmacy was cost effective in reducing the 10-year CVD risk in patients with diabetes on the long term 10 years. Okay, so we are aiming to share this study with policymakers in order to implement the role of a clinical pharmacy in reducing the CVD risk for patients with diabetes. And thank you.
Thank you, Dr. Rimal.
Thank you.
Any questions?
Any question?